Good evening. Welcome to the Friday edition of the News at 6. I'm Shira Matsuzawa. Thank you so much for joining us. And we begin tonight with news from the Idaho Department of Health and Welfare. Our state is overwhelmed with the number of COVID cases reported. And now Health and Welfare says the numbers they're reporting are likely lower than reality. And this is largely due to a backlog of thousands of cases awaiting review by local health districts. Our Andrew Bartline spoke to local health districts today about how this is impacting their reporting.
Health and welfare numbers show Twin Falls is currently a hotspot for COVID-19 transmission.
We have a lot of cases. It is our largest metropolis area in our district.
With 362 reported COVID cases, Health and Welfare says Twin Falls is the 5th highest county in the state. And that's not even the most accurate figure.
We are several hundred cases behind. Those are cases we just cannot access.
Brianna Bodley is the Public Information Officer at South Central Public Health District in Twin Falls. Of the 11,200 cases in the backlog, Bodley says 500 of those are in her district.
It's actually quite a bit smaller for us. 11,000 is an overwhelming number, definitely. We actually feel like 500 is an overwhelming number of cases that we cannot reach. Of course, what we would prefer is to have 0 of those cases waiting.
Health and Welfare says in an email this backlog has been growing over the past 2 months as the number of reported cases exceeds what local health districts can process. Health and Welfare added it's impossible to know how the numbers will be impacted when they catch up, but it's fair to say they will definitely increase.
Every disease is being reported there, and we have COVID-19, we have RSV, we have a host of reportable diseases right now that are spreading quickly through our communities, filling up that space.
As these cases are processed over time, Health and Welfare says they will retroactively update their weekly data on the COVID dashboard. This ensures cases are counted for the week the case was reported and not the week a local health district processed the case. But catching up may not happen for a while. Central Health District in Boise is the largest health district in the state. They say in an email they're receiving 1,000 cases per day, while they can only process up to 600 cases per day. And that deficit will continue to grow the backlog and further delay reporting. Andrew Bartline, Idaho's News Channel 7.
And this just into our newsroom, the Department of Health and Welfare now says the backlog is down to 9,700 cases. Health districts are now asking people to self-report when they test positive for COVID, and this helps streamline the process as health districts are so overwhelmed with this backlog. You can self-report online by visiting your local public health district's website.